So we are studying urinary tract radiology. So in previous class we discussed important imaging modalities. So next part is we know that pathology of urinary system. So what are the important diseases? Okay, and what are the investigation of choice? Okay, so we will discuss in this class. So important urinary pathologies which are common in our clinic. So we'll discuss today. So basically first kidney. So we will get into the sequence kidney. So today we'll discuss only kidney part. So kidney, it will filter the, okay, it will filter the, okay, it will filter the blood, okay, it will filter the blood, okay. In the blood, the waste products will come into the uterus, ureter, then urinary bladder, okay, then urethra. So urine will go outside from the urethra. So basically, urinary bladder, urethra, ureter, or kidney, these are all very, very important organs because it excretes the waste products from the body. Okay. So what are the pathologies? Important pathologies we have. So basically, most common disease of kidney is kidney stone. We all are know that kidney stones are most common disease nowadays because of urea based products we are using. Okay. So the first investigation of choice for kidney stone is ultrasonography. So any abdominal pain, you have to advise the ultrasonography. It is very, very important. Next, the investigation of choice is NCCT. So to see the exact location, to know the how much is there, and is there any other issues related kidney, ureter, urinary bladder, or else urethra, you need to do CECT abdomen. So renal stone. The renal stones also known as renal calculi. Okay, renal calculi. So we'll see in the report that in the impression it will come the renal calculus. So it will give 16 into 12 something like 5 into 6. Okay, like Sometimes it will give 1 centimeter, 10 like that. So 5 centimeter is length, 6 centimeter breadth. So whole stone is minimum 5 length, 6 breadth. Okay. So the investigation of choice is CECT abdomen for renal stones. So you can see that acidic types of stones like urea, uric acid type, crystalline stones. So they are very highly uh, non-absorbable, non-melting, but alkaline calcium stones, it highly absorbable, highly uh, absorbable. Okay, and gout, hyperparathyroidism. These are also reason inflammation, UTI, medications. LASIX, all are common. So there's the reason kidney stones are most common. Kidney stones are very, very common. Next, you have, you can see these are the kidney stone symptoms. So patient have fever, stomach pain, vomiting, dizziness, blood in the urine, and backache. So these are the common symptoms you can see. You can see these are the types of kidney stones. Okay, cystine stones. Okay, cystine stones and calcium stones, uric acid stones, steroid stones. So these are the important important types of stones we can see here. So CCT is the investigation of choice, and ultrasonography is the first investigation. Okay. Next, in second place. The next type of common disease, that is acute pyelonephritis. Okay. So this is the kidney infection. Okay. So you can see this, the image. Okay. Pyelonephritis. This is the inflammation. You can see pus. Okay. You can see this is the in the kidney, within the kidney parenchyma. Okay. Within the kidney parenchyma. So what is the investigation of choice? CECT. What is the investigation of choice? CECT. So what is the first investigation of choice is ultra sonography. Okay. Next disease, the common disease, that is tuberculosis of urinary tract. Okay. So these are the like, areas where tuberculosis occurs, and you can see radiographically. Okay. You can see in the kidney region what will happen. Uh, Stenosis occurs. Okay. Calyx, mouth eaten calyx, like here, the shape will occurs. Okay. So different things here written. We will not go into detail, but tuberculosis of urinary tract is the third most common disease. Okay, of according to a pathology of urinary tract. Okay, so what are the investigation of choice of urinary TB? Urinary TB, you have to CECT, give and contrast medium scan. CECT abdomen or KUV is the most common investigation of choice of urinary tuberculosis. Okay, so we discussed renal stone, we discussed acute pyelonephritis, we discussed urinary TB. Next, another common type of diseases in the urinary tract, that is renal mass. You can see renal mass. One second, please. Hmm. Renal mass. Okay. So this is the renal mass. So first, what will happen? Cyst occurs here also given. Then after it will convert into the mass. Then mostly tumor. So renal cyst. You can see here the renal cyst. Renal cyst. These are the cysts. Fluid collection in the kidney. Fluid collection in the kidney. First infection occurs, then cyst will happen, then it will convert into the mass, small or medium or large type mass, then it will convert into the tumor or it will convert into the cancer. So these are the step-by-step procedures. Okay. It will direct cancer will not happen, but rarely. Okay. So these are the renal cyst. And another thing is that you can see that here, this is the renal mass. The renal mass cyst occurs, lipoma also occur, abscess happen, sometimes metastasis. These are the more advanced form of disease. Okay, so all these are common. It is any type of renal mass. Next, we have, you can see that here, renal cancer. The last stage of cyst, polynephritis, renal cyst, renal uh, mass, renal cancer. Okay, most common risk, what are those? Smoking, exposing to harmful chemical like cadmium. Okay, so what you have to do? You have to maintain a healthy body weight, eat healthy, maintain a healthy blood pressure, maintain a healthy blood pressure. Okay, maintain a healthy blood pressure. So all this are the common diseases. So what is the investigation of choice? So we have renal cyst, we have renal masses. Okay, we have renal CA. So all this first investigation of choice is USG abdomen, and second is we go through first cyst, CECT enough, CECT KUB is enough. Masses, and for cancer you have to go through MR urogram or MR KUB. So this will give the tissue type. Okay, these are the tissue. We can see the tissue level scan with the MRKUB, like MRI. Okay, MR urogram or MR KUB. Okay, and another type of common diseases which occurs in the kidney, that is renal artery stenosis. The artery which bringing blood to the kidney. The artery which bringing the blood to the kidney. Okay, supply blood supply to the kidney. Okay, it is blockage, stenosis of renal artery, or called renal artery stenosis. Okay, these are the second last common diseases, mostly in hypertension, renal artery stenosis, hypertension also will call this, due to the any abnormality. Let's see the image. So this is the renal arterial stenosis. So here a plague, it may be uh, cholesterolic plaque or embolism. It will came from heart. It enter into the kidney, embolism, thrombosis. Okay, any type of cholesterol accumulation leads to deficient supply of art blood supply to the kidney. This leads to renal artery stenosis. So stenosis happen. So large amount of pressure is generating there. Okay, it will leads to less supply blood to the kidney, but pressure increases. So pressure increases. Okay, so this will happen in the renal artery stenosis. So what is the radiologically you have to investigation. So if a patient have high level of hypertension, okay, all the reports are normal for of cardiac, everything is normal, then you have to go through kidney test, because here we have the problem in the kidney. You have accumulation of cholesterol is happen, that is called atherosclerosis. Okay, so the investigation of choice of renal arterial stenosis, first investigation of choice is MR angiography. So angiography is to be done. Doctor will advise to angiography. Okay. Next, gold standard scan, that is nothing but DSA. DSA. DSA means digital subtraction angiography. Digital subtraction angiography. So these are the two scans which will give you a perfect idea of which artery blocked in the kidney and how much amount is blocked. So what type of treatment to be done. Okay. So these are the kidney main important diseases like kidney stones, acute pyelonephritis, other diseases also there, but these are the common which are seen in the clinical practice. So urinary TB, renal masses, renal cyst, renal carcinoma, and arterial stenosis. So tomorrow we'll discuss bladder pathologies, urethral pathologies, ureter pathologies. Okay. So this will discuss tomorrow. So I hope you understood the today's class.